speaking at the National Institutes of Health on Thursday, President Biden announced the U.S. has finalized the purchase of an additional 200 million doses of COVID-19 vaccine, creating enough supply for 300 million Americans by the end of July.
And the one way of getting the vaccine is at pharmacies, with the new program promising an increased supply directly from the federal government to many locations. So let's bring in now the Executive Vice President and Chief Medical Officer of CVS Health, Dr. Troy Brennan. Dr. Brennan, thank you for being here. And how much is this going to help for pharmacies to be able to get it directly from the federal government and not having to go through states?
Well, I think it makes it smoother, a bit more efficient, and we can then begin to set up to distribute the vaccine in our pharmacies. And we feel like we're going to be able to do that in a way that both improves the equity associated with the distribution of the vaccine and also the speed at which the vaccine can get out to people.
Yeah, and speaking of the speed in which it can get out to people, Dr. Brennan, you know one of the biggest problems has been people trying to sign up for getting a vaccine, not being able to get a time slot. How do people who are watching right now go to your pharmacies and get that vaccine? What do they need to do?
Well, we started the program yesterday, and we're relying heavily on a digital front end to be able to get people scheduled. So people are reaching us primarily through their smartphones and digital devices. And when they schedule their appointment, they also schedule an appointment for their follow-up vaccine, because we'll be using the vaccines that require the second booster. And that'll be appropriately timed depending on which sort of vaccine we're giving in each state. People can also call up. We have phone lines that are open. And we're also beginning to make outbound calls to try to encourage people to get vaccinated as well. Yesterday, we opened up and we booked 160,000 appointments, and we've got about 250,000 doses in this first tranche. That's in 11 states and about 350 stores.
We have seen criticism about how the rollout has gone, not just the speed, but also the fact that some underserved communities, including many communities of color, are not getting their hands on the vaccine the way they should, or as quickly as they should, don't have the same access. What are you all doing to make sure you address that issue?
We're taking several steps. First of all, obviously, we have a diversity of stores in a lot of different neighborhoods. So we're choosing our retail pharmacies that are in particular areas that have what the CDC calls a high social vulnerability index, and also our stores that serve predominantly people of color, so that we're going to be distributing the vaccine where people are. We're going to have our pharmacists and our pharmacy teams making outbound calls to the people who use those pharmacies to encourage them to get vaccinated. We'll also be using our call centers that we have at our insurance company, Aetna, as well as our pharmacy benefit management company, Caremark, to make the same kind of outbound calls. And we'll be having outreach on local media using our pharmacists and our nurses who represent a broad range of different races to encourage people to come in and get vaccinated. Right now, we're in a period of time in which there's not enough vaccine, but we foresee a situation in 4 to 6, 8 weeks where there's going to be much more vaccine on the streets and many more pharmacies being used. And we think we're going to switch over time from having a glut of people who want to get in and get vaccinated to then encouraging more people to get vaccinated.
And Dr. Brennan, we should point out CVS has been involved in vaccinations for some time now. In fact, your company has played a big role in making sure both residents and workers at long-term care facilities are getting their vaccines. How has that effort been going?
Well, it's gone very well. You know, we're impatient Americans, and we should be about this. And so when the rollout first began, people were very impatient and wondered if the vaccine was being distributed appropriately. What we said was that over a 6 to 8 week period of time, we would provide vaccinations for the long-term care facilities, both skilled nursing facilities and assisted living facilities who had chosen us. That's more than 45,000 different institutions. That over a 6 to 8 week period, we would get all of those people vaccinated. The skilled nursing facilities began just at the very end of December. And as we sit here today on February 12th, we've given 100% of those skilled nursing facilities their first dose, and 93% of them have gotten a second dose. So we'll finish this program on time. And I think, we'll look back on it as being a tremendous step with regard to public health in this country to have reached out and given 4 or 5 million doses of vaccine to people who couldn't get out to stores or other sites in order to get themselves vaccinated.
Well, thank you so much. I know we'll need to. This will be going for a while, so we hope we can check in with you again. CVS Health Executive Vice President and Chief Medical Officer, Dr. Troy Brennan. Sir, thank you so much.
Thank you for having me.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.